Hi, I'm Dr. Brian Koffman, a retired family doctor, the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. And I'm going to be presenting some of the most important research that's happened in 2023 in CLL. What I'm talking about next is a paper that presented at the ICML 2023, the International Congress on Malignant Lymphomas. In the paper discussed Venetoclax, Atezolizumab, and Obinutuzumab combination for Richter's syndrome. Let's start with the bottom line. Atezolizumab, Obinutuzumab, and the Venetoclax combination was quite active in patients with untreated diffuse large B-cell lymphoma, variation of Richter's syndrome. The triplet led to durable remissions longer than 2 years in 1 out of 3 patients. The research was presented by Dr. Fratasi from Milan, Italy, who led the presenters at the International Conference on Malignant Lymphoma, ICML, in June 2023 in Lugano, Switzerland. In the way of background, Richter's syndrome, or Richter's transformation, are the names for when chronic lymphocytic leukemia, small lymphocytic lymphoma, CLL/SLL, transforms into a more aggressive form of lymphoma, most commonly diffuse large B-cell lymphoma, DLBCL. It carries a terrible prognosis and remains a critical unmet need with largely ineffective chemotherapy used as its treatment. This study looks at adding Atezolizumab, which is a checkpoint inhibitor that unleashes the immune system to attack cancers, to 2 more familiar CLL/SLL drugs, Obinutuzumab or Gazyva, and Venetoclax, that have been shown to have some activity in Richter's syndrome also. Let's look at the methods and who the participants were in the study. The treatment consisted of 35 21-day cycles of Obinutuzumab, 1,000 milligrams, cycles 1 through 8, Atezolizumab, 1,200 milligrams, cycles 1 through 18, and Venetoclax, after the ramp-up, 400 milligrams, cycles 1 through 35. The primary endpoint was an overall response rate of 2 out of 3 patients by cycle 6. Minimal residual disease, MRD, was tested by 8-color flow cytometry and next-generation sequencing, NGS, on peripheral blood and plasma. 28 patients were enrolled between October 2019 and October 2022, but 1 died of infection and 2 dropped out of the trial early before any evaluations. What were the results? The overall response rate was 67.9, or 19 of 28, thus meeting the primary endpoint. Complete response rate was 28.6. No particular clinical characteristics influenced the overall response rate at cycle 6. After a median follow-up of a little less than a year, 11 out of 19 patients, 57.9%, were still in a continuous remission, 8 were on active therapy, 2 had received allogeneic hematopoietic stem cell transplants or bone marrow transplants, and 1 had discontinued due to myelodysplastic syndrome or MDS. 6 of those in remission have stayed in remission for more than 2 years. Of the remaining 8 patients, 7 progressed after a median of 14 cycles. 1 died from sepsis at cycle 9 in remission. Median duration of response was 11.7 months. Median progression-free survival, or PFS, was 16.2 months, and the median overall survival was an impressive 31.6 months. Out of the 13 patients who progressed, 4 received a salvage therapy and are alive at a median follow-up of over 2 years. Bulky disease and poor overall health, in other words, a high ECOG score, tended to lead to poor progression-free survival. A total of 43 grade 3 or 4, which are the more severe adverse events, occurred. 17 patients, 60%, most had hematological problems, 51%. Any grade adverse events was reported in 6 patients, grades 3 to 4 and 2, but none led to continuation. No tumor lysis was observed. Serious infections occurred in 6 patients, including 2 who died. 1 patient developed MDS, as I mentioned earlier. So in conclusion, 16 months of progression-free survival and 31 months of overall survival may not sound super, but it is better than many other Richter syndrome treatments, and this is a chemo-free treatment. The addition of the checkpoint inhibitor in past Richter syndrome trials has not been convincingly helpful, but these results with this combination are promising, and Richter syndrome sure needs some fresh therapies. We have a link to the actual abstract from ICML, Efficacy and Safety of MOLTO, M-O-L-T-O, a multi-centered, open-label, phase 2 clinical trial involving Venetoclax, Atezolizumab, and Obinutuzumab combination in Richter syndrome. And we also have a link to more information on this presented by Dr. Neaton James from MD Anderson at ASH 2021. Thanks for listening. Stay strong. We are all in this together.